Well, staying with health for a moment longer, and the disestablishment of the Māori Health Authority has been described as one of the greatest crimes against health in our country. Former Health New Zealand Chair Rob Campbell made the comment while submitting at the Waitangi Tribunal's latest inquiry into the scrapping of Te Ako Whai Ora. Here's Imogen Wells.
For some, arguing for better Māori health outcomes has been a long, long fight.
Back to the very same problems I spoke about 20 years ago.
The public health system has struggled and, to some extent, failed to meet the health needs of Māori for the entirety of its existence.
They say the fight's all the more harder since the government scrapped the Māori Health Authority last year. The Waitangi Tribunal now in its second part of an inquiry into that move after already finding the Crown breached Te Tiriti o Waitangi by disestablishing Te Ako Whai Ora without proper consultation.
The destruction of Te Ako Whai Ora has been one of the greatest, I think, crimes against health services that this country has ever seen committed.
This week is all about answering three main questions. What are the Crown's alternative plans for Māori health? Was the Crown's process in developing the plans consistent with Te Tiriti o Waitangi principles? And are said plans consistent with the treaty as well?
The answer to each of those questions is simply no. There has been no alternative plan, and the Crown's actions have not been consistent with Te Tiriti o Waitangi.
The belief Te Ako Whai Ora was never given a chance, a big theme.
How long do you think it would have needed to really be able to become well established and demonstrate more fully what it could achieve?
Quite some years. It would not have been achieved within 3 or 4 years, I think.
Te Ako Whai Ora was a beacon of hope.
Disappointment too after late last week the Crown withdrew its only witness and at the lack of visibility of Health New Zealand representatives.
The way I take it is that they're disinterested in the proceedings. I find that very, very offensive.
Officials from the Ministry of Health are very much participating in this inquiry on that live stream, even though they're not in the room here with us.
But plenty of opportunities to get in the room, with the hearing set to continue till Friday.